Dr. Bradley Freeman joins us each and every Wednesday. He is professor of surgery at Washington University, and we are getting him on the phone right now. We are getting some difficulty, if you will. And then Kat Neville's going to be along with a couple of restaurants. And then next hour, comedian J.B. Smoove, who is hosting Last Comic Standing. But first, here's Dr. Bradley Freeman, professor of surgery at Washington University. Good morning, Dr. Bradley Freeman. Doctor, are you there?
I am.
Good.
I am.
All right, good to talk to you. So, this note you passed me, in which there are a large number of Americans who want to get elective surgery and decide to do it cheaper by going outside of the country?
It turns out that this is a relatively large industry. It's called medical tourism, and it's grown over recent years for people who, say, are paying out of pocket for various procedures or in somewhat unusual circumstances are interested in procedures that are not commonly performed in the United States. So probably most of these procedures are such things as cosmetic surgery and also such things as, say, morbid obesity surgery, such as the gastric bands or the gastric bypasses for people that are morbidly obese. But it turns out that a large number of people pursue this. It's estimated 750,000 individual U.S. citizens a year travel abroad for the purposes of receiving medical care. And so the interesting thing is there was a report recently from the Center for Disease Control that really tracks all kinds of diseases, they're based in Atlanta. And they identified several women who had traveled down to the Dominican Republic for cosmetic surgery, and they contracted these very unusual and very hard to treat infections. And so they traveled down there for cosmetic procedures such as liposuction and tummy tucks and breast augmentation. They came back, had these very severe infections which required long hospitalizations, multiple surgeries to correct them, and again, very difficult to treat. And they were spread out through the United States. And I think it really speaks to some of the dangers of pursuing medicine outside the United States. Now, having said that, I think there's some very good providers outside the United States, and there's some resources online that can guide consumers as to who are reliable providers and who are not. But I think this story really illustrates that probably the quality controls outside the United States, particularly in maybe lesser developed countries, are not up to the standards that the U.S. citizens expect.
How many people are we talking about who do this?
How many providers? It's huge. If you go online, there's a huge opportunity to travel outside and seek treatment.
So you in this note you said 750,000 U.S. citizens travel a year.
Yes.
To go outside the country.
Yes.
To go get some type of elective surgery.
Yes. That's the estimate.
And a lot of them women. Right.
A lot of them women, and again, Kelly, I think it's generally things that are not going to be covered by insurance or that are discretionary, if you will. So the drivers of that would be something like cosmetic surgery. No, that's not going to be all of it, but so it's going to be things that say your insurance company wouldn't traditionally cover, or that would have a very large out-of-pocket component.
And they do this because it's cheaper, if you will.
Cheaper, but as this story would illustrate, in some instances, like everything in life, you get what you pay for.
Right.
Exactly.
No, thank you. I'm going to have my liposuction right here in St. Louis.
Yes, that will probably temper your enthusiasm for doing that,
McGraw. What is a virtual autopsy?
Yeah, so this is something that has come along in the last few months, a concept that's come along in the last few months, and we don't really like to talk about autopsies. It's kind of a morbid topic, if you will, but an autopsy is by definition, an exam that's performed on an individual or a patient after they've expired to understand the causes of death and things that have led to the death, and it's certainly the gold standard in the history of medicine as to understand how diseases progress and how they ultimately cause patients to succumb to them. And it turns out that autopsies are on the decline for a variety of reasons. It was a few decades ago, maybe in the 60s and 70s, 40 to 50% of patients that expired in a hospital and sometimes outside the hospital would undergo autopsies. That's declined dramatically to much less than 10% of patients who expire now. undergo autopsies, and that's driven by things that the way our ability to diagnose illnesses before death is much better. The reimbursement for pathologists to do autopsies has declined dramatically, and frequently patients' families, as you can imagine, really decline requests for autopsies because certainly there is a very emotionally fraught time, and it's a difficult topic and conversation to have with patients' families. So this concept, can you use other modalities to examine a deceased person, and such things as CAT scans and MRI scans, and so there's a few centers who have started using this on an investigational basis, and it turns out that this appears to be quite accurate. So I think while this is not going to be something that is going to be standard as we speak, I think it's going to be something coming down the pike, and I think it will probably continue to diminish the role of the traditional autopsy. But having said that, autopsy is still a very important educational tool, and it teaches physicians a lot about how to better care for patients in the future.
So if somebody dies from a heart attack, they don't necessarily get an autopsy unless the family says, please do an autopsy?
Well, there are settings where, if you will, the decision for an autopsy is at the discretion of a medical examiner, such as a homicide case, or there's certain medical settings where the case would be reviewed by a medical examiner, and irrespective of, say, the family's wishes, an autopsy might be performed.
Right.
And sometimes it would not be particularly educational to perform an autopsy, though a family might be interested in having an autopsy. So I think generally it's the care providers, the clinicians, that drive the requests for the autopsy. But sometimes families are interested, but
Gotcha.
Generally it comes from the physicians.
Earlier today, Kelly had a story about Jerry Springer heading down to B-Town, Branson. And then I got a note, Doctor. You wanted me to bring up Jerry Springer?
No, I said it's. I told your very talented producer it's very hard to follow a story about Jerry Springer or germs on airplanes. So I'm always a very esteemed company. But I think Jerry Springer is a very entrepreneurial and interesting individual.
I would agree with that. What do you think of that story about the E. coli living on airplanes for days on end?
Well, we talked a few weeks ago about germs that you found on dollar bills that were detected by genetic fingerprinting, and I think it just shows that these germs are ubiquitous, and because of new techniques, we're able to detect them in all types of places that were never thought to look. And germs are a two-edged sword. We need them to have a healthy body, but some of them obviously are very resistant to antibiotics and can cause disease. And I think it's a sign of the time that you're traveling in an enclosed space and you're exposed to these types of things. I'm not sure it is a tremendous public health worry on the surface, to be honest with you.
You know what? That's a great point, because the point is, if you're exposed to these germs, you build up resistance to them. If you're never exposed to them, it's much more dangerous.
Oh, that's right. And when you say treat patients with antibiotics that eliminate various classes of germs, the other germs, if you will, can take over and wreak havoc on the body and cause very profound infections. So we're very dependent upon the germ ecosystem to maintain a healthy state of living.
Dr. Bradley Freeman, always a pleasure. Have a good week, and enjoy your Jerry Springer this week.
Hey, I watch it every day.
Doctor, have a good day. Thanks.
Have a great day.
8:30, Big 550, KTRS.
Target Talk St. Louis is presented by the